One challenge that's included in the package that doesn't have any first-year funding implications or savings implications, and that's because the committee felt as though it was more reasonably phased in over a period of time, and perhaps it would be year 2 before some savings are achieved, but it seemed to be a powerful enough challenge that we included it in the package. And that is purchasing health care for public employees. And this is really pooling the lives that are covered by health care and doing a better job of negotiating those contracts. The challenge is to improve the quality of Vermont public employee health care while spending less through pooling purchasing power. And then there are some redesign options that are listed as examples. One of them is leveraging increased purchasing power to negotiate better health care outcomes for lower rates. Another one is to increase the number of options for many employees now in smaller groups. And then the last one I might highlight is to use volume to negotiate total cost of care contracts with health plans or with provider collaboratives as well. And we anticipate that this may also require a one-time investment to design a pooled purchasing system and perhaps involve some technology tools or development of some technology tools so we can measure whether or not we're actually improving results and saving money.
So in summary, what we have here is a set of challenges. They're not fully baked proposals. And the committee is being asked, not necessarily to endorse these ideas, but to endorse the idea of challenging people to pursue these things. And this, following the issuance of a challenge, then would begin the work of actually redesigning these services. And in some cases, the redesign may involve policy changes or changes in law, which would obviously come back to the legislature and go through the normal process of review and critique and so forth before it could be enacted. In other cases, the reforms might be administrative in nature. I do want to stress, though, that this is these are going to be very scary challenges to the people that you would be holding accountable for executing them and for delivering better outcomes, to the people in the executive branch or in the designated agencies or school districts or wherever. And so the support that you provide to them is absolutely critical if you expect them to succeed at the challenge. And so, as Cindy mentioned, in some of these there are investments, one-time investments that we believe will need to be made for them to be successful. But also, I think this is going to be a challenge to the legislature. If there's going to be reform, everyone has to change. Not just the executive branch or designated agencies or school districts. And that includes the legislature. So embedded in this results-based approach are challenges to you all to think differently and to deliberate differently. And I believe that these pursuing a results-based approach will actually strengthen your accountability that you have over how state dollars are spent, which is an essential part of your job. But it involves, instead of getting involved in FTEs and procedures and processes, that's your only vehicle for accountability that you have available to you today. It involves shifting to holding people accountable for results and having them come back to you and report actual outcomes and numbers, and leaving to them, and particularly to the professionals, the decisions about how to achieve those results. And so that's a change, that if you decide to go forward with this, that you all would be bringing on yourselves as well as on others.
Well, and not only that, it'll change the nature of the conversation between the legislative and executive branch. And you'll be talking more about how to overcome barriers than you will be about the details of implementation.
Thank you. Senator White?
Can I just ask a procedural question?